So my name's Melanie Roberts and I've been sitting in the background listening intently, and I'll be here to feed the questions to Madeline and Rob. So we've had a few come through. I think Madeline has answered some already. So we have a question: what is the app called for Auslan? So Madeline has been through a few options there. Was there anything else you wanted to add to that, Rob?
No, it's available from the Royal Institute for Deaf and Blind Children, which is now called Next Sense. But you just go to the App Store and Google or search for Auslan Tutor, and then it comes up. It's a terrific app.
Yeah. And yeah, accessible for great to have that so mobile as well, so that when you need the sign, you can actually look it up rather than a day later or a
Exactly.
few days later trying to recreate that moment. Yeah.
Yeah. And
Um,
just to learn, I mean, you might be on a train or a bus or traveling on a plane, whatever. You could just be, learning by using the app, just choosing a word and said, oh, another word, and then have a break when you had enough, and then go back to it. It's quite very handy, very very accessible.
yeah. There's another website that I use quite a bit with the Auslan Sign Bank as well, but that will also give you the regional signs, because I think Auslan Shooter is a more Australian East Coast based sign. There's a lot of similarities, but we don't necessarily get the regional variations in that. And so Sign Bank, a website, can give you those regional variations, as well as a few more options for a sign that might suit your context better as well. Yeah. So we have a few more questions coming through. Are there standardized touch cues or signs on the body that can be used with deafblind children with no vision, or are these made on a case-by-case basis? I'll send that to you first, Rob, and then to Madeline.
Yeah, there was a long time ago, a woman did try to set up a standardized touch cue program, and I don't know whether it ever took off or it got embraced. But from my point of view, it has to be a kind of person to person to person that will work. But the key out of that for me is to make sure it's meaningful, so that you might be stabbing in the dark about whether that's going to make sense to the child or not, but you'll know if it is through the responses if it's working. So and then I think families develop and use the same touch cue once they've established them. A lot of them are really kind of obvious. It might be that it's going up, up. So another thing hit my head then. Certainly when you're using hand over hand to give touch cues, really, really important not to grab the kid's hands and do it. Offer your hands so that they can put their hands on your hands, and then you can do it then. That's still giving the child the control of the situation, and that you're not imposing. Because often when you grab kids with low vision or who are blind, their hands, they will pull back because they don't know what's going on. So it's really about offering, developing that trust so that the child will then, so you just give a little touch and they will then find your hands, and then you give the touch cue that's appropriate to the situation. Madeline, can you add to that at all?
Look, we used the touch cue similarly when he was a lot smaller, and to get his attention was just a gentle tap, which he later on didn't enjoy. He much preferred a firmer tap than a gentle tap. But it just made me think of when he was getting used to going to the dentist, some of the steps that the dentist took to get him used to having something in his mouth. So remember, he's not an oral eater. He's never had food in his mouth. So to have a oral procedure being done would be incredibly invasive. And I think it took 12 months of just going and sitting in the chair and playing with the brush and the suction. And again, he was suctioned a lot as a baby, so have that suctioning would have been frightful for him as well. And so this was at the children's. So 12 months of just him sitting in the chair and having control of all the implements. And she would sometimes just try and get in and have a quick look, but it would be hardly anything. And this was, a pretty hefty journey into the city for every appointment, but gosh, it was worth it. because he goes to the dentist with absolutely no problems whatsoever. Absolutely no problems whatsoever these days. And that was built up over many, many visits to the dentist of doing nothing but giving him control.
Madeline, can you cast your mind back 20 or more years and remember some of the touch cues that you used with Sean when he was little?
Yeah, look, a lot of it was around that bath time, because that's a very intimate time when you are, you know, you're dedicated to the task. You've got a child in water. Obviously, you've got to be, you know, on and concentrating and very much involved. And so the bath time was usually those times when you would introduce because we used to bathe him in the kitchen, and the bath would come out, the big bath that would sit on the thing, the kettle would go on, things would come out of the bathroom. He would help bring things out. He would have the towel or the washer. Then the taking off of the clothes was a process as well, because most of those would end up in the dirty pile and then into the bath, and what we'll put in the soap in. But yeah, it was definitely a continuous and repetitive routine that he was used to seeing and having done because of the process, the same process that we would go through.
Yep. What about some of what the doctors did? So you mentioned when Sean was going to have a blood test. Could you demonstrate the touch cue that they used to indicate that?
So challenging. So he was in for 6 months. Most of the time I couldn't stay at night time, so he was on his own at night. So I don't know what happened when I wasn't there. I did put signs around his cot to say, please don't do anything before telling me or touching me, to let me know you're there. And of course, the 2 years of constant hospitalisations was the same thing. I sometimes couldn't stay there, and so he was left to his own devices. But I was, a story that I remember today was he would have a lot of IVs. He'd have to have a lot of IVs because of the injections that he had. And of course, he then had veins that wouldn't work, so they would go constantly searching for veins, or putting an IV in was a lengthy process. And one time when it was a lengthy process, he just stuck his thumbs up and did that. And I said to the doctor, you have to stop. You need to give him a break. Can you just leave him for a few minutes? And he was in control of that situation. And he would have been 2.5. But that just clearly, you know, to have that power at that age, to be able to sign, to make a movement with your hand and have the exact action that you want, which is stop. And I did that. That was incredibly powerful for him.
Yep. So was that the finish sign? Was that something you started modelling quite early for him?
Yes. We started at 3 months.
Yeah.
3 months.
Yeah.
His brother, this was his sign for Owen. He was doing that well and truly, very, very, very quickly.
Yeah. Yep. So with the doctors, was it just a matter of tapping the place that they were going to try and put the IV in or take blood before then proceeding, or just a tap in the body area? Is that?
I can remember them picking his foot up, because often they'd be putting it in his foot and just rubbing his foot.
Yep.
Not just pick and, you know, put the needle in, which was what was happening in the early days. You know, I have nothing against the nursing staff. Absolutely, they are under the pressure. Absolutely under the pressure. Just it is compounded when the individual has sensory losses like our kids do. And I don't know, you know, if there's been research ever done on people with sensory losses in that environment as infants that have this constant 6 months of it, remember, 24 hours a day of medical intervention, multiple bloods taken. Are there long-term effects with how he then reacts to pain, how he reacts to light touch? I don't know, but it'd be interesting to find out if there has been any research done on that type of thing for sensory loss.
I think there are a few people on that, and share your thoughts there, Madeline. I remember we had a guest speaker who talked about some of her early touch cues as well, and Mum and Dad had different touch cues for her, so she would know that it wasn't going to be a doctor that's coming over now. It's Mum or it's Dad, and they each had a different way of first touching her before then picking her up, or, you know, carrying on their interactions. And that happened when she was an infant in hospital. So yeah, definitely a case by case, and the situation that you need to be communicating about and preparing them for as well. So yeah, a dictionary idea would be fantastic, but in reality, each person needs to create their own dictionary, I think. Would you agree there?
Yeah.
Yeah.
And I could add to that, you've got the touch cue, like it might be the injection's going to go in here, and then there may be the object, which might be the needle to hold and touch, or if it's nasogastric feeding, it's going to be going through, and then this is the tube that's going in. So it's a time to process what is about to happen and giving as many clues as possible and cues to make it a reality.
Yeah. I've got another question for you adding on from that. So sometimes we get maybe a reaction from parents or carers about, I don't want you to warn them about an unpleasant experience that's coming up. I just want you to do it and get it over it done as fast, because I don't want them to be worried about it. I just want it to be happening over. Do you have any thoughts on that?
It's a really good question. Because, absolutely parents wanting to make it, let's get this done and finished and move on. However, I tend to err on the fact that, just to be fair on the child, they need, even if it's not going to be a nice thing to happen, they need a bit of warning as to what's happening. And it might already be the warning. There could be, just moving into that room where there's this bright light, and that gives a cue enough that something's going to happen is not going to be fabulous. So I think, adding to the information might be fair, but I do understand the parents' feelings as well.
Yeah. Sometimes I sort of say, well, if your child could see the needle and see the IV, would you cover their eyes? And often they'll say, no, I wouldn't do that. And it's like, with what you're asking is sort of something similar then, to not be able to give them the opportunity or the same kind of access about knowing what's about going to happen, even if it's not pleasant. But, we all still need time to prepare ourselves for something unpleasant. Yeah. Madeline, did you have anything to add to that?
Look, I've sat through too many IV attempts to know. I sometimes regret doing it. Sometimes regret being the one who was there when he was being hurt, going through such terrible pain. Could I have used a strategy of letting him know that this was going to happen, the doctors are going to take you, they're going to do that, and then when you come back to me, I'll comfort you. But I was there when it was all happening. And, the contrast to that was, and this is again, no offence to anybody, but my husband would come in at the end of the day and bathe him. And I'd be the one that would be there when he was screaming because he was having IVs trying to be put in. I really struggle with that these days. Did I make the right choice? I'm not quite sure.
Well, we have some more questions coming through. I think, Rob, you touched on this towards the end of your speech. What is your opinion on the label deaf-blind? And that sort of came back. They sort of was asked about the same time you were talking about that. So maybe could you just expand on that a little bit more?
Well, certainly deaf-blind is the international word now. So the Americans and the British and we use deaf-blind to talk about, and I think it's a very difficult term because people think deaf-blind meaning you're blind and you're completely deaf, and we know that that's just so far from the reality. It just means that there is a vision and a hearing disability that the individual is coping with. And it's not about being deaf and, there's a vision problem as well. There's a vision problem. And there's a deaf. It's the combined deaf blindness, the deaf and the hearing, and the vision are a combined thing and need to be dealt with under that and with that knowledge. So Madeline talked about the sensory thing, and you're usually adding in other sensory stuff as well. Certainly with kids with charge, smell, taste, and touch is often better if it's really firm. So there are varying things within that, but I think it's really up to the individual as to what they're comfortable with. I don't think parents stay uncomfortable with deaf-blind. I think they can be uncomfortable initially, and that's fine, and we can work around that. And then in time, because the literature, stuff they read, what they hear, eventually the language may settle into being a comfortable way of saying it. I just think we have to be very sensitive to the fact that often the terms we use can be really challenging and really confronting, and we need to think about those terms as well, and be very sensitive and gentle about it.
Madeline, do you remember the first time you heard that term?
Well, David Brown had mentioned, David Brown, the deafblind educator in the US, had mentioned earlier in our journey that using the deafblind label, for want of another word, is the best way to go for kids with Charge syndrome. And, you know, the fact that the NDIS didn't recognise deafblindness as a primary disability until very recently speaks of the challenges that families had had before then. My son's not deaf. He doesn't belong in the proper deaf community because they like to sign in dark places where there's loud music, and they sign too fast because his vision won't keep up with it. And yet he's not really a blind person because he doesn't read Braille, and his speech is really difficult, and his, you know, he can use sign to supplement that. So, you know, those communities are there for him, yes, but he doesn't really belong to them. Deaf-blind community, again, he's not fully deaf-blind. You know, I don't know, what's the middle ground if it's not deaf-blind? It certainly helps people understand that having a dual sensory impairment makes a difference, is different to just having one sensory impairment. And so I use it as an opportunity to teach people that he's not deaf and he's not blind. He's actually got a dual sensory loss, so he's deaf, blind, and that he has different needs.
Yeah. We have an audience comment on that too. So anecdotally, in regards to the term deaf-blind, I feel like the general population don't yet understand what it is. I find myself saying deaf and blind unless speaking to someone in the disability community. Yeah, so that's a good tip. Yeah. And, you know, some people say, yeah, it's definitely a journey, I think. And, you know, people will stop in different places with it. Yeah.
And that's a good comment too, because I think we probably are maybe doing a disservice by kind of softening it down, because deaf-blind, one word, is really correct, I think. So if we kind of dilute that, then it's really not being fair on the individual, because that does name the disability. But I'm much more comfortable that when I can communicate that with the person and say, what do you prefer as your description for what your disability is, so that they can own what they feel comfortable with too.
Yeah, yep. Okay, so we've got still some more. I'm just choosing an order. So in addition to the topic of the signing apps, it wasn't a question, but they're just adding some more information. There's also an app by RIDBC, or now Next Sense, called Adapting Signs that can be used to develop a personalised sign dictionary. So that's a great one to take video and photos and load into that app. And they've used it before for developing personalised tactile sign dictionary and adapted signs for limited physical mobility. So yeah, that's definitely, and that's available on the Next Sense website for download and in the App Store.
Thank you, whoever said that. Good on you.
Yeah. Another comment and question. So thank you, Rob and Madeline. Your information was fantastic and so relevant. I was hoping to learn more about working with deafblind students or children who actually have very low vision. In these situations, Auslan and visuals are not the best. Maybe could we expand on this in another PD, or did you want to add anything there?
Yeah, for me, yes. The hands, tactile, touch, everything becomes a whole different process. So it's about really getting trust in hand over hand. So the individual has hand over your hand. And so that the signing comes from there, the gestures come from there. And so it becomes, can become quite formalized in time, because you'll be able to use formal signs with hand over hand. but you initially it might be that we're going to go over there now, and then off we go, and we go to sit down, and then we go to, and yeah, whatever you need, cue, hands come to you, or hands go to there, take off your top for a time for a bath, or so it becomes a process of hand over hand, and hopefully that you are making sense of what you're doing. But the trust factor is really important, because that will be the way you communicate.
And just to add to that, Meredith and I are working on a video resource at the moment on that topic. So it's looking at tactile communication using the hands, and focusing on the different options there with some video examples. So hopefully we'll be recording that towards the end of this year, and it will be available sometime next year.
Available where?
On the website.
Okay.
And we'll probably do a webinar on it as well.
Fabulous. Yeah. Wonderful.
Yeah,
because I really feel for people who are working with kids who have very low vision and are profoundly deaf, it is a totally different journey, and so often we don't get to explore the ways with that. So that's a wonderful resource that's coming your way.
Yeah. A few more comments. A webinar, please, for that. So great, it's very needed. Another comment, just acknowledging that it's not just doctors and nurses who overlook informing before procedures. It extends to allied health professionals. And I think lots of people who lack that awareness and are still developing a deafblind mindset, I think. And it takes a while. You have to learn it along the way. There's not many people around to teach you. And then we have another question. Are there processes to support identity formation for young adults with charge?
I'm not sure.
Can you explain a bit more, please?
I'll wait for the person. So I guess around, accepting, my guess is accepting who you are, what you need, advocating for it, and being comfortable and happy in your own skin, I guess.
Yep. That's right.
Yeah, but the processes.
Shall I go, Madeline, or do you want to go?
No, I'm not quite clear.
Where I see that happening is when they either gathering at a conference, all the individuals who are charged syndrome or deafblind or whatever, they're in a very happy space once they get together. Then you hope from that there will be a connection through other ways, because that might only happen every 2 years or every whenever, so that there will be then a group established where they can connect like this. So there will be a Zoom meeting, emails, texting to connect with each other. And it's really important, because otherwise they are just sort of this alone person who has, like you hear African-American people say, the first time I ever saw a person like me on television when they saw Oprah Winfrey. So about that, is there another person like me out there? And whatever we can do to support that and help is really important. Madeline?
Look, I'll just add that we're in I suppose it's an exciting phase. The syndrome's been around since 81. Our population are surviving, and they are keeping well, and they're progressing through school. They're being supported. Some are going into further studies, some are going into employment, some are becoming quite the advocates themselves. So we have a generation of people with Charge syndrome who I think are going to do some great things if given the opportunity, and there are some great opportunities. So we've just had 2 of them put their hand up to join a council, a focus group council, to feed back into disability research based on their experiences of having Charge syndrome. And that's really exciting, because we don't hear those voices often enough. And I think that there is a great future ahead to really get a much more understanding of what it is to have charge syndrome if we can have these voices being shared at the table.
And our audience member says, love hearing the validation of peer support.
Yeah.
Yeah.
And just going back to the tactile kind of communication with the hands. In the meantime, Max Deafblind on YouTube is a great resource for tactile communication with the hands and what it looks like in practice. I think that's an US family there.
Thank you.
Okay.
Yep.
So that brings us to the end of our question and answers. I think, yes. So thank you, audience, for your interest and contributions and your curiosity around the information that was presented and beyond. Thank you, Rob, for sharing your vast experience, being so generous with your time and giving us an intro to, the options and process and lead-ins and wonderful little tips about dinners with the voice off, quiet table or, visual communication timetable. So thank you there, Madeline, for that inspiring story and sharing that beautiful photographic journey of your son, Sean. I can imagine there's a lot of that was very hard and not an easy time. So I appreciate your openness and honesty and the courage to show the world.
Thank you, Melanie.
Thank you to our interpreters, Nick and
Naomi.
yes, blank, and our captioner who's beavering away in the background there. Okay, so thank you everyone again, and good night.